For centuries, the story of analytical medicine has often begun in ancient Greece, with Hippocrates, with careful observation, with the first attempt to explain disease without blaming gods or demons. But what if that story began much earlier? What if, long before the Greek medical schools, an Egyptian surgeon was already thinking like a scientist? Today, we are opening a papyrus about 3,700 years old, and it preserves a medical tradition that may reach back almost 5,000 years. It contains the earliest known written use of the word brain. It describes skull fractures, torn membranes, throbbing wounds, and the terrible signs of neurological injury. This is not the story of one proven operation. It is something bigger. The first surviving written window into brain trauma, surgical judgment, and clinical logic. Welcome to PharaohLogic. Let us unlock the mystery of the Edwin Smith Papyrus. The modern story begins in Luxor, Egypt, in 1862. An American named Edwin Smith was living there during the American Civil War. Smith was not only an antiquities dealer, he was also one of the early American students of ancient Egyptian writing. He bought a damaged medical scroll from a local merchant named Mustafa Aga, but the scroll was incomplete. 2 months later, a group of men brought him fragments glued onto a dummy roll. It looked like a trick to fool buyers, but Smith noticed something extraordinary. The fragments belonged to the same medical scroll he had already purchased. A fake roll had hidden a real treasure. Smith tried to understand the text, but the full translation would wait for decades. After his death, the papyrus was donated to the New York Historical Society. Then James Henry Breasted spent 10 years translating and publishing it. When the translation appeared in 1930, the world discovered something astonishing. Its main surgical treatise was not a book of spells, it was a trauma manual. In much of the ancient world, pain and sickness were often explained through magic, spirits, or divine punishment. Many medical texts mixed treatment with prayers, charms, and incantations. But the Edwin Smith Papyrus is different. Its main surgical section is built around 48 cases. They are arranged from the top of the head downward: head wounds, face injuries, jaw, throat, neck, shoulders, chest, and spine. For each case, the ancient surgeon followed a careful clinical sequence. First, a title, then an examination, then a diagnosis, then treatment or prognosis. The structure feels astonishingly close to a modern clinical casebook, and every diagnosis ends with a verdict. 1. An ailment which I will treat. 2. An ailment with which I will contend. And 3. An ailment not to be treated. That third sentence is chilling. It means the surgeon sometimes recorded cases even when he believed the patient could not be saved. That is the beginning of something profound. Not just healing, observation, classification, reasoning. Then comes the part that makes this papyrus unforgettable: the head injuries. In case number 6, the surgeon describes a severe skull fracture. The wound is open, the skull is broken into pieces, and the membranes around the brain are ruptured. To describe what he sees, the surgeon reaches for a metaphor from the world around him. He compares the folds of the brain to the ripples that form on molten copper slag. This is one of the earliest known descriptions of the brain in human writing. But the text does not stop at anatomy. In case number 8, the patient has a crushed skull under the skin, with no open wound visible from outside. The surgeon does not guess. He examines. He looks at the eyes. He watches how the patient walks. He notes bleeding from the ears and nose, and he connects the injury in the skull with weakness and movement far away in the body. With constant attention to the side of the head that was injured, he records one of the earliest known observations of how injuries to the brain affect movement. The papyrus also reveals another astonishing idea. The body had vessels, and the heart was connected to them. In case number 1, the commentary explains how a physician should examine a patient. He places his hands or fingers on the head, the back of the head, the hands, the pulse, or the feet. The text says he is measuring the heart, because the heart pulsation is in every vessel of every member. This is the earliest known written evidence for measuring the human pulse. But we must be careful. This does not mean the Egyptians understood blood circulation exactly as modern medicine does. It means they saw the heart as the center of a vessel system spread through the body. Centuries later, the Greek physician Herophilos worked in Alexandria. He is often credited with developing the practice of counting the pulse, but Alexandria was in Egypt. And the Edwin Smith Papyrus provides the earliest surviving written evidence that older Egyptian medical knowledge had already touched this idea long before him. This brings us back to Hippocrates. The Greeks gave medicine a powerful written tradition, but they did not live in isolation. Greek scholars traveled to Egypt to study, and some scholars argue that Greek medicine may have known Egyptian surgical teachings like those preserved in the Edwin Smith Papyrus. One of the clearest examples is case number 25, a dislocated jaw. The Egyptian instruction is direct and practical. Put your thumbs inside the mouth on the ends of the jaw. Place your fingers under the chin. Then push the jaw back until it rests in its place. More than 2,000 years later, the Hippocratic texts describe a strikingly similar method. The same problem, the same hand logic, the same practical reduction. Breasted believed the similarity was too strong to dismiss as coincidence. So the question is not whether Greece mattered. It did. The deeper question is whether the roots of clinical medicine reach further back into the Nile Valley. The author of the Edwin Smith Papyrus remains unknown. Breasted cautiously suggested that such a work may have been linked to Imhotep, but that remains a conjecture. What matters is the mind behind the text, a mind that looked at wounds and searched for physical causes, a mind that separated cases into treatable, uncertain, and hopeless, a mind that named the brain, described its surface, and linked head injury to movement in the body. Long before modern hospitals, this Egyptian surgeon left a written record of clinical thought, not magic, not myth, observation, evidence, judgment. And that is why the Edwin Smith Papyrus is not just an ancient document. It is one of the earliest surviving moments when medicine began to think. This was PharaohLogic Origins. Thank you for watching. We will see you in the next mystery.